What is pelvic inflammatory disease? Pelvic inflammatory disease is also referred to as PID, is an infection of one or more of the upper reproductive organs, including the uterus, fallopian tubes, and ovaries. Untreated can cause scar tissue and pockets of infected fluid to develop in the reproductive tract, which can cause permanent damage. Causes of pelvic inflammatory disease. Many types of bacteria can cause pelvic inflammatory disease, but gonorrhea or chlamydia infections are the most common. These bacteria are usually acquired during unprotected sex. Bacteria can also enter the reproductive tract anytime the normal barrier created by the cervix is disturbed. This can happen during menstruation and after childbirth, miscarriage, or abortion. Symptoms includes pain, ranging from mild to severe, in the lower abdomen and pelvis. Fever, sometimes with chills. Unusual or heavy vaginal discharge that may have an unpleasant odor. Unusual bleeding from the vagina, especially during or after sex, or between periods. Painful, frequent, or difficult urination. Pain during sex. Complications are ectopic pregnancy. Pelvic inflammatory disease is a major cause of tubal, ectopic pregnancy. An ectopic pregnancy can occur when untreated PID has caused scar tissue to develop in the fallopian tubes. The scar tissue prevents the fertilized egg from making its way through the fallopian tube to implant in the uterus. Instead, the egg implants in the fallopian tube. Ectopic pregnancies can cause massive, life-threatening bleeding and require emergency medical attention. Infertility due to damage of the reproductive organs. The more times a person have had PID, the greater their risk of infertility. Delaying treatment for PID also dramatically increases the risk of infertility. Chronic pelvic pain. Pelvic inflammatory disease can cause pelvic pain that might last for months or years. It can also cause scarring in the fallopian tubes and other pelvic organs. It causes pain during intercourse and ovulation. Tubo-ovarian abscess. Pelvic inflammatory disease might cause an abscess, a collection of pus, to form in the reproductive tract, most commonly in ovaries, but they can also develop in the uterus or in other pelvic organs. If an abscess is left untreated, it could develop a life-threatening infection. Risk factors. A number of factors might increase the risk of pelvic inflammatory disease, including 1. Being sexually active and younger than 25 years old. 2. Having multiple sexual partners. 3. Being in a sexual relationship with someone who has more than one sex partner. 4. Having sex without a condom. 5. Douching regularly, which upsets the balance of good versus harmful bacteria in the vagina. 6. Having a history of pelvic inflammatory disease or a sexually transmitted infection. Prevention of pelvic inflammatory disease. 1. Practice safe sex. Use condoms during sex. Limit the number of partners and ask about a potential partner's sexual history. 2. Talk to your healthcare provider about contraception. Many forms of contraception do not protect against the development of PID. Using barrier methods, such as a condom, even if you take birth control pills, use a condom every time you have sex with a new partner to protect against STIs. Helps to reduce the risk. 3. Get tested. If you're at risk of an STI, make an appointment with your provider for testing. Set up a regular screening schedule with your provider if needed. Early treatment of an STI gives you the best chance of avoiding PID. Kindly like, subscribe, and turn on the notification bell to get updates from us. Thanks for watching.